Hi, my name is Dagmar Ehling. I'm a licensed acupuncturist, and I want to share with you today about the blog and share with you a little video about holistic solutions for allergic rhinitis, sinusitis, and postnasal drip. A little bit about my person. I'm a practicing acupuncturist, Chinese herbal and functional medical practitioner, and nutritional coach since 1989. I'm the author of the Chinese Herbalist Handbook, published in 1994. I taught oral medicine to German physicians for over 10 years in German and online courses to acupuncturists for healthy seminars in Vancouver, Canada. I was a faculty member at Southwest Acupuncture College and the International Institute of Chinese Medicine in Santa Fe, New Mexico in the 90s. I served as a committee member for the National Certification Commission of Acupuncture and Oriental Medicine and the American Board of Oriental Reproductive Medicine, both of which are entities that design a national exam for either Chinese herbal medicine or reproductive medicine, respectively, to practitioners. I'm a co-owner of Oriental Health Solutions. We're 5 acupuncturists and 1 physician, and we offer a variety of services to our patients. Little disclaimer, in Chinese and functional medicine, all treatments are custom tailored to the patient's specific presentation. This video only addresses general suggestions and is for educational purposes only. Please use the herbs mentioned in this video at your own risk. If you're in doubt, please check with your physician or Chinese herbal medicine practitioner before implementing any new strategies, especially if you're pregnant or take prescription medications. I want to first delve with you into some definitions of Chinese medicine. When we talk about airborne pathogen, we know in Western medicine we talk about pollen, mold, dust mites, grasses, and all those things, viruses, bacteria. And in Chinese medicine, we really are not that interested about what the pathogen is. We're really interested about how it manifests in the person's body. So we can have either a wind-cold pattern or a wind-heat pattern. The wind-cold pattern is chills is greater than, the person will experience chills greater than fever. They'll have a body ache, shoulder aches, headaches, a scratchy throat. Whereas in a wind-heat pattern, there will be greater fever than chills, or they will just be hot and irritable, along with the body aches and headaches, and maybe now a sore throat with potentially swollen lymph glands. Because it's an airborne pathogen that invaded the body, the treatment strategy is to push the pathogen out of the body through diaphoresis or through sweat induction. That is the Chinese medical approach to dealing with this. And then, of course, if the wind is not properly treated at the right phase, then the wind can go deeper into the lungs and cause either a phlegm damp in the lungs or a phlegm heat pattern in the lungs. So to first delve into those terms, let's define the term of how water pathology works in Chinese medicine. So we know that the body is 70% water. And we know that cells need to have good exchange of fluids into and out of the cells. We know that nutrients need to be delivered to the cells and waste materials need to be moved out of the cell. And that's best when the water is very fluid. However, if there's a wind pathogen that has obstructed the proper flow or it has already developed into phlegm heat or phlegm damp, then we know that the water can get a little murky. So the person might have a stuffy nose or some discharge from the nose. And then if that's not properly treated, that can turn into dampness. And so that will be thicker phlegm in the sinuses and nose or postnasal drip. And then if that's not properly treated, it can turn into phlegm, which is just thicker and stickier. And then, of course, if the phlegm is cold, then it'll be white or clear phlegm, and if it's hot phlegm, then it's yellow or green. Or if phlegm is, again, not treated properly, then we can also see phlegm nodulation, which is a pattern that we discuss in Chinese medicine, really more in gynecology. So like a woman who has ovarian cysts for many years, at some point they can actually turn into stone, or fibrocystic breast disease, where the cysts can turn into calcifications. So that's a more severe pattern we don't see as much in respiratory diseases, but just for completion's sake, how water pathology is viewed in Chinese medicine, I want you to have that overview. So the treatment strategy, if there's still wind, we want to induce sweating again. And then for the phlegm damp, we want to resolve the phlegm damp. Or if there is phlegm heat, we want to resolve the phlegm heat. And we have herbs for either phase. And so we can combine different herbs that will do the job for that. I want to just briefly touch upon digestion. It is really important to note that people in America have a very damp diet. So lots of dairy, lots of gluten, lots of cold and raw foods, lots of smoothies, lots of protein shakes. Those are all very damp creating in the digestive tract. So I want to encourage you to make sure that you're consuming cooked foods at least 80% of the time, particularly if you have a lot of phlegm and congestion and postnasal drip all the time or year round, then you definitely will have a great chance of having a likelihood of having a damp digestive tract. And a damp digestive tract leads to having more congestion and phlegm in your head and in various parts. So it's really important that you avoid damp foods. And the best way to avoid it and the easiest, cheapest way to avoid that is to consume cooked foods most of the time. And it doesn't mean you can't have a salad, just have a salad with a hot soup. Okay, so just, keep that in mind. But don't do ice water, don't do ice cream, iced tea, iced coffee, all that stuff. It just really makes your digestive tract very cold and damp. Let's delve into some home remedies. Ginger tea is a great remedy for wind-cold situations. You can combine it with a little scallion. Use 3 to 4 slices of ginger and 1 diced scallion per cup of water. Bring to a boil, simmer for 5 to 10 minutes, and then wrap yourself in clothing or blankets and drink the tea while it's still warm. This will induce a mild whole body sweat to release the exterior and to release the pathogen while staying hydrated, of course. You can also take a hot bath while drinking the ginger tea, or you can do a sauna while staying hydrated. And then, of course, ginger also has another benefit in that it's helpful for treating nausea. So people who have chronic nausea, of course, one would want to figure out what the actual causes of the nausea. But if you just have it periodically or you have anxiety that manifests as nausea, ginger tea is a great way to settle your stomach. Peppermint tea is used in a wind heat situation. If you don't grow it in the garden, it's very easy to grow. You can use 2 peppermint tea bags in an 8-ounce mug and let it steep until cold enough to drink. And then you want to essentially, that will clear all the heat that you have and will make you less irritable because you're so hot and uncomfortable. And of course, it will also cause a little bit of sweating. Peppermint also, as another benefit that peppermint has, it will treat superficial itchy rashes and bring them to the surface, and you can sweat them out. And so people who have hives, which is in Chinese medicine called a wind heat rash, which are basically the characteristic is that the rash comes and goes very quickly. Sometimes it's there, sometimes it's not there, and it moves around. So that's the characteristic of a wind heat rash, and peppermint will address that. Chrysanthemum tea, which you can buy at a Chinese food store, Juhua is the Chinese name, is to be used in a wind heat situation affecting the eyes when the eyes are red and itchy during allergy season. Use 1 tablespoon in an 8-ounce mug and then steep for about 10 minutes. You can drink the tea several times a day, and you can also dip some cosmetic pads into the tea and then just place them on your eyes with, as a warm compress. So that's a really great way to do that. Magnolia buds, Xinyihua, can also be bought in the Chinese food stores, used for wind cold, causing sinus or nasal congestion with a runny, clear discharge. Use 1 tablespoon in an 8-ounce mug and steep for a few minutes, and then drink it, and then use either as a tea, or you can drape a towel over your cooking pot and then just inhale the steam of the magnolia buds. They're very lovely, have a very lovely sort of kind of mildly eucalyptus smell. They're really lovely. In Chinese herbal medicine, all formulas are custom tailored on the patient's specific complaint and history. And in my upcoming course series, I will teach you how to use certain herbs safely. In fact, I won't just teach you about herbs. I will also teach you about some functional medical tricks, how to optimize your diet, and also introduce some homeopathic remedies. So as you read the blog and as you scroll down on the blog on the last paragraph, you can click on the bottom to opt in to be notified when the upcoming free course series is coming up. And I have not scheduled it yet, but I will soon. And I hope you can join us. Thank you.